I think the question that I receive most consistently from caregivers, sometimes it's in front of the patient, sometimes it's when the patient's gone to the bathroom. It's, shoot me straight. What's really happening? What are their chances? It doesn't always work like that. Sometimes it's the patient that wants numbers and wants all the details. But often I find that the caregiver, like we've discussed already this evening, is wanting to be that strong and supportive person for their loved one. And so they may not want to bring up the hard questions like that in front of them. So that's probably what I would say I hear, most frequently. And I respond, by saying this is an important question and we should talk about it with your loved one here because we all need to be on the same page. I think it can't be overstated how important it is for the patient to know very early on the goals of treatment and the way that we're thinking about, as an oncology team, thinking about their treatment. It's not always appropriate at the very first visit, but early on we have to begin conversations if they are, advanced or metastatic, about advanced care planning and preparing for things like that. And I find that generally those conversations are best done over time in small snippets, but they go smoother when you begin it early. Sometimes when you start talking about mutations or genetic mutations, people start to think, oh no, this is something that, I could pass on to my child, or this is something I inherited. And, you'll see their eyes get big when you start to use words like mutations. And that's where it's really important that we differentiate and say, no, I am just testing for mutations inside your cancer cell. These are not mutations normally in lung cancer. There are a few, germline alterations occasionally we'll see in lung cancer, but that's very rare. And so I try to explain that the next generation sequencing, it's somatic testing that's looking at the cancer cell DNA and mutations within that, not in their normal healthy cells. And then, obviously, if there is something that's germline or there's a hereditary risk factor, then, we'll have the genetic counselor conversation and appropriate referral. But most of the time, it just takes that distinction so that people understand these are just mistakes in my cancer cells that are allowing my cancer to grow. This isn't something that, I have to worry about for my children.
I think the most common question I get from patients and their caregivers is, what stage am I? What stage is he? Because I do meet them early and we may not have had the PET scan yet or the MRI of the brain, I kind of gently tell them we don't really know the staging of this yet. And when the doctor knows, then I will help you formulate questions that you can ask him about the staging or her about the staging. But that definitely is one of the biggest questions I get is, what stage is he? Because everybody knows if they hear, stage 4, that, that's doom and gloom. But that is probably the most important. The other question that I get most is, how can I make them eat? They won't eat anything. I cook, I give them whatever I want. How do I get them to eat? So that's definitely the number 2 question that I get from especially the loved ones. And I try to explain to them that, right now your loved one does not feel like eating, but let's break this down into small meals, and we go over through on ways that they can do that. So that's the number 2 question is, how can I get them to eat?
The most common question for me is, how did this happen? I didn't feel sick. I got short of breath and came into the ER, and now you're telling me I have stage 4 cancer. So there's a little bit of the disbelief on how on earth this could happen to them. And I frequently explain to them that everyone has cancer in their body, but it's like flipping on a light switch. Some people's light switch gets flipped on and their cancer begins to grow and multiply, and that's when you see that tumor develop. Other people, their cancer switch doesn't ever get flipped on, and they don't have have any need of any type of treatment or anything. So that's the most common question that I get. And then again, because that patient is stage 4, I get a lot of questions as far as about what treatment will look like for them and can they be cured. And so I'm always very honest with my patient. I like to be able to explain to them that when you have a stage 4 cancer, the goal is not for a cure, but the goal is to prolong your life so that you can have as many enjoyable life experiences as possible. And I love to be able to reassure them that I have several patients that are stage 4 and they've been in treatment for 4 or 5 years and they are doing quite well and having a great quality life. In the area of the next generation sequencing, I don't get very many questions on it. Probably have about 30% of my patients that are never smokers, but I still don't have many questions about the next generation sequencing for whatever reason.